I am Dr. Saikat Mitra. Today's topic is Parkinsonism. Parkinsonism is a neurological illness that has got four principal features, which are mainly tremor. Tremor means the trembling of the hands, which mainly occurs at the resting plate. That means when the patient or when the individual is resting, he is not working, then his hands are trembling. That is called tremor, rest tremor. That is the first one, the number one point in the diagnosis of Parkinsonism. And next comes the bradykinesia. Bradykinesia means slowness of movements. When the patient starts walking, or when the patient starts speaking, or when the patient initiates some kind of voluntary activity, then the patient uh, undergoes a kind of slowness and then he initiates the activity. So that is called bradykinesia in the medical term. The next thing which comes, that is called rigidity. Rigidity means stiffness of the limbs, stiffness of the whole body. And when we are resisting the movement of the patient, then we encounter a kind of stiffness that is called rigidity. And the fourth one, it is called postural instability. That means when the patient is walking on, when the patient is kind of initiating any voluntary activity, then the patient experiences a kind of fall. That is, he or she can fall head on, or he can have a kind of kind of instability in his movement. So that is called postural instability. So these are the four cardinal features of Parkinsonism: rest tremor, bradykinesia, this postural instability and rigidity. Apart from these problems, patient can also experience a lot of other problems, like say there is fluctuation in BP, there is problems in his or her mood, like psychiatric problems can initiate. There may be problems in memory loss, dementia, and likewise. These are Parkinsonism is a global illness and of the brain, so it can also encompass a lot of other cognitive activities which whose impairment can follow. The most important cause is obviously genetic. There are some kind of mutations in the gene, and the part of the brain in the brain which is called basal ganglia, where which is responsible for the movement of the body, the voluntary movement of the body. In that part, there are some kind of problems in the genetic mutations. Genetics is the principal causative factor behind Parkinsonism. There are also some kind of environmental factors like stress and all, but we cannot yet prove. Parkinsonism is principally a disorder of the older people, and it progresses faster in older people because there is lack of caregiver support. There may also be accompanying dementia and memory loss, and the patient before developing Parkinsonism, the patient can also be voluntarily unstable or like that. So definitely it progresses faster because all the other cognitive areas are also jeopardized in Parkinsonism. So definitely, and Parkinsonism is common in elderly people rather than the young people. There are four features which I have already stated, but other than that, often patient come to us with a lot of other symptoms which can precede the Parkinson feature. Like say, if the patient has got falls, recurrent falls, and it's not explained by the other factors, and when the patient is having forgetfulness or memory loss, when the patient is having say incontinence or inability to hold urine. So these are the features when patient comes with these kinds of symptoms, then we may suspect the process of Parkinsonism, the degenerative process in the brain has already started, and then possibly those four features will eventually come into the picture. So we have to be clinically suspicious and then diagnose accordingly. Parkinsonism, the most important thing is that the treatment is a lengthy one, and it can take a lifelong process because Parkinsonism is essentially a neurodegenerative disorder. Because some neurons, some nerves in the body, in the brain, in the part that is called basal ganglia, which is genetically impaired, and the patient is experiencing this kind of problem. So obviously, we cannot repair the genetic part. So obviously, we have to deal with the patient's symptomatic things to heal his problems. So mainly, what we are having, there are some drugs like say which are called dopamine enhancers or dopamine agonists, because dopamine is a neurotransmitter which is responsible for the movement part of the body. And in the Parkinson's disease, what happens that the dopamine circuit in the basal ganglia, it is deficient. The disease of Parkinsonism, the care should begin from home, because you know that in the Parkinson disease, the disorders, the symptoms of the disorders, that is so varied and so multifaceted, that obviously the patient will eventually go into the bedridden capacity if he is not cared for. So definitely we should make the caregivers cautious about how the symptoms progress. Then we have to assist the patient, like say some kind of walking measures, walking sticks like that, and some kind of physiotherapy is often applicable. It will heal the patient's rigidity and tremor. And of course, if the patient has got any kind of memory problems, then patient is forgetful to take his medication. Then the caregiver should be made aware of the fact that the medication should be offered by them. It shouldn't be relied on the patients only. And next is the regular visit to the physiotherapist, treating neuropsychiatrist. These kind of things should ensue, because in Parkinson disease, there are some kind of psychiatric symptoms also. Because if the patient is unable to move properly, then possibly the patient can develop depression, and also some kind of uh, aggression and agitation and anger outburst, which is not which was not there. So obviously we have to take care of that. If these kinds of symptoms appear, then caregivers or the family members should obviously report to the treating doctor. Be prepared that if you have got Parkinsonism, then obviously the treatment should last long, and it's a very tedious journey, because the Parkinsonism is a process of degeneration in the brain, and we are just giving some supplements. It's not actually, we are just controlling the symptoms. We are not curing it, because there is no definite cure for the disorder. For the caregivers, you just don't lose hope. Just identify the symptoms, and if there are some kind of problems other than the 4 symptoms which I have described, if there are some other problems like say the other associated features, then go to your doctor and tell them accordingly. There may be frequent changes in medication in the first few months or years, so be prepared for that. And obviously that this dopamine treatment, dopamine agonist treatment, what I have just described, it has got side effects of, say, some patients can have got behavioral problems like agitation and anger and like that. So then we have to add on some kind of medication to allay those symptoms too. So obviously, for the patients, the advice is that just adhere to the medication, just visit to your doctor regularly, and for the caregivers, identify the symptoms and report your symptoms to the doctor in a proper way, and in time, so that the care can be offered before the degeneration sets in and the degeneration progresses further.